Albuquerque doctors are aiding other doctors worldwide on their COVID-19 response, all from behind their computer screen. News 13's Courtney Allen joins us live from home with details.
Jess, Project Echo began back in 2003 when a local doctor noticed his patient wait list was 8 months long. He started the program to train rural doctors so patients in those places wouldn't have to travel to places like Albuquerque to get specialty care. Now the program is exploding due to COVID.
Dr. Sanjeev Arora at UNM is very familiar with video chatting.
We had been using Zoom for more than 5 years.
The founder of Project Echo has been training other doctors remotely for years on anything from HIV to diabetes. Then along came COVID.
We essentially had the railway tracks, but we started driving COVID-19 trains on them.
Last year, Aurora says they had fewer than 250,000 people tuning into their video chats worldwide. In the last 9 months, that number jumped to 750,000, with 14,000 participating from all 33 counties in New Mexico.
Every doctor, every nurse, every community health worker in the world was hungry. They had no idea what to do.
They have these video conferences several times a week, with doctors sharing actual cases and problems they're encountering. The biggest questions at first were how doctors should protect themselves, their staff, and patients from COVID, then transitioning into how doctors can provide virtual care for non-COVID patients and recommendations for ventilator settings and handling new treatments like remdesivir.
By mid-August, there had been 23,500 new publications on new information in COVID-19. And how was a rural doctor or nurse to keep up with it? So we took on that role to get the latest information to them.
He says it's an all-teach-all approach where everyone learns from each other.
Sometimes academic center doctors like me don't really understand all the barriers that rural clinicians face. When they bring those barriers, other rural clinicians from other parts of New Mexico help them solve it.
He says healthcare can be provided anywhere by moving knowledge instead of patients.
We want to help everyone, every single healthcare provider in New Mexico.
Project Echo has people joining from 160 countries using the platform worldwide to train on 100 different diseases. Back to you.
All right, thank you, Courtney. Project Echo just received a $237 million contract from the federal government to launch a network for nursing homes nationwide to improve their COVID care.